Hello, and welcome to the Johnson & Johnson Education Modules for Mental Health. This program intends to reinforce the skills considered essential for providing optimal care for mental health patients in the primary care setting. Today, we will begin with a general overview of mental health throughout the Southeast Asia region. Along the way, we will discuss the prevalence and immense socioeconomic burden of mental health disorders in this region. Then, we will begin the discussion on optimising mental health care by identifying priority areas for improvement. Let us begin. The information provided in this slide deck is for educational purposes only and is not intended for use as a sole determinant of therapy. Healthcare providers should make the most appropriate clinical decisions for their patients on an individual basis. Before we begin, we'll go over the player controls that will be available for you when you're playing a slide. Once you begin watching a course, the player controls will become active, and they appear here, just below the slide. The first one is the play-pause control. The next and back button you see here allows you to move to next and previous slides respectively. Once you have completed watching a slide, you simply click the next button, and it will take you to the next slide. If you want to revisit the last slide, the back button will do just that. Next, we have the seek bar. It shows the progress of how far along you are in the timeline. If you want to navigate within the timeline of the slide, you can also do that by clicking on the seek bar anywhere here. Anywhere you click along this bar, it will jump to that point in the timeline. To the right of the seek bar is the rewind button. By clicking this button, you can quickly jump back to the beginning of the timeline. This is useful when you want to jump back to review something that has just been said or demonstrated. At the far left of the control bar is the volume control. Simply drag it up to increase the volume or down to decrease the volume, or drag it all the way down to mute it. The last button we have is the option to toggle closed captioning on and off. By clicking this, closed captioning will turn on, indicated by this highlighted button, and the text that appears on the player. Closed captioning allows students with hearing impairments to be able to follow along with their training. And there you have it. These are the player controls you can use to control your learning experience. For this course, it is essential that the learner is able to describe the epidemiology of mental health disorders globally and in Southeast Asia. Describe the socioeconomic burden, morbidity and mortality associated with mental health disorders. Identify priority areas for improving mental health care in the Southeast Asia region. Let us begin by exploring why a positive mental state is important. Positive mental health has been associated with numerous benefits, including improved overall health status, higher educational achievement, enhanced productivity and earnings, improved interpersonal relationships, closer social connections, improved quality of life and better parenting. In contrast, poor mental health may lead to impairment across one or several of these areas. Let us begin by exploring why a positive mental state is important. Positive mental health has been associated with numerous benefits, including improved overall health status, higher educational achievement, enhanced productivity and earnings, improved interpersonal relationships, closer social connections, improved quality of life and better parenting. In contrast, poor mental health may lead to impairment across one or several of these areas. Let us begin by exploring why a positive mental state is important. Positive mental health has been associated with numerous benefits, including improved overall health status, higher educational achievement, enhanced productivity and earnings, improved interpersonal relationships, closer social connections, improved quality of life, and better parenting. In contrast, poor mental health may lead to impairment across one or several of these areas. To summarise thus far, the World Health Organization estimates that 25% of all patients using a health service suffer from at least one mental, neurological or behavioural disorder, most of which are undiagnosed or untreated. Positive mental health has been associated with numerous benefits, including improved overall health status, higher educational achievement, enhanced productivity and earnings, improved interpersonal relationships, closer social connections, improved quality of life and better parenting. Mental well-being can be impacted by not only one's individual attributes and behaviours, but also their socioeconomic circumstances and the environment in which they live. The existence of a chronic medical condition can exacerbate an individual's risk of developing a mental health disorder, and vice versa. Similar to the other core components which constitute one's well-being, mental health disorders require a comprehensive strategy to prevent, treat and recover. Within the Asia-Pacific region, the top 5 mental health issues are depression, anxiety, post-traumatic stress disorder, PTSD, suicidal behaviour and substance abuse disorder. Mental health and substance abuse disorders contributed to 183.9 million, or 7.4%, of all disability-adjusted life years worldwide. In 2010, the estimated global cost of mental health disorders was $2.5 trillion. About 2/3 of this cost was attributable to indirect costs, including reduced worker productivity, loss of work, and worker replacement. A meta-analysis including 133 studies found that the risk of all-cause mortality was more than twice as high in patients with a mental health disorder. The World Health Organization estimates that the 26% of the world's population living in the 11 countries of the WHO Southeast Asia region accounts for 39% of global suicide. Based on epidemiological studies performed around the world, the World Health Organization found the treatment gap to be as high as 32% for schizophrenia, 56% for depression or dysthymia, 50% for bipolar disorder, 58% for generalized anxiety disorder, 60% for obsessive compulsive disorder, and 78% for alcohol abuse disorders. Priority areas for improvement of mental health care in Southeast Asia include consistent mental health policy implementation, financial allocation for mental health care, improved human and treatment facility resources, a robust mental health information system, and a scalable plan which can be implemented. We will now engage in a brief knowledge check to reinforce the concepts covered so far. Let us begin. Congratulations, you have completed the Johnson & Johnson module on mental health care epidemiology. Today we have covered the prevalence, burden, areas requiring improvement for mental health in the Southeast Asia region. Thank you for your attention.